little pediatric flat foot deformity. Actually, you're not pediatric anymore, but it was a pediatric deformity. You were born with flat feet, right? Mm-hmm. So we started to have pain. We fixed this about, she's 19 now. We fixed this, I think when you were about 16. About 3 years ago, we fixed this side. It was more of an emergency fix. We did a kidney, went in here, cleaned that out, did a little transfer. That's why the incision looks like this. And a good old Evans osteotomy right about here, put a little bone graft in there. This was about 3 years ago. This is very recent to make it match. So you see a little discoloration there. The surgery for this was a little bit more extensive because, well, more tendon tear. But again, we still went for the Evans right here. I'm going to watch the young lady stand and see how flat her foot is. Okay, this is the young lady standing up right now. I had her stand. This is, how long ago did we do the right foot surgery?
Like a year, maybe 2 years ago now.
The
right one?
The right one, the newest one.
6 months, 7 months ago.
6 months ago. So we're gonna go into the caverns right here. See, now she has an arch. This one was done 3 years ago, 2 or 3 years ago. She also has an arch. Now, before we had the surgery, it was very flat, no?
Yeah.
And it was very painful. That's why we did the surgery, not because it was flat, but because it was painful. Am I correct?
Yes.
Yeah. Let's turn your foot around. All the way around. Let me see your heel. Now I'm looking at the calcaneal alignment. That looks really good right now. Again, the arch is good. Any knee pain or anything?
No.
Okay. Pick a side, face a side, so we can see the side. Yep, and we're gonna turn around. Okay, there's the left one, the one with the blue anklet. We did that about 3 years ago. Again, she was having a lot of pain. That's the only reason why we did the surgery. It was symptomatic. And then we're gonna go ahead and turn the other way completely around. We're gonna see the other one. This is the 6 months ago. Beautiful arch. Now, the beauty of this is we're able to fix the tendon and transfer a tendon, as well as, similar to here, we did a calcaneal graft, a cadaver calcaneal graft, called the Evans calcaneal graft. We'll go over that a little bit later. But yeah, looks awesome. How do you feel with it?
It feels amazing. No pain.
Are you able to run, walk?
I'm slowly able to run, yeah.
Yeah?
Yeah.
Good. Now, when you had the pediatric flat, when you had the flat foot, before we did any surgery on you, what were the symptoms?
It hurt from my ankles to my knees, and then I felt like a bunch of back pain. It was like the worst pain ever. I couldn't really work because of it.
And now you're able to be active, productive?
Yeah.
Do sports now?
Oh yeah, starting to run again.
Okay. You met me through your father, right? Because
yeah.
we fixed his ankle and everything.
Yeah.
So he's doing really good, and now we've gotten you fixed already. Anyone else in your family with the same?
No, not that I know of.
Oh, thank God, right?
Right.
So face me one more time. I'm going to take a look at the, this is a beautiful correction. I'm very happy with that. So any questions for me?
No, I think that's it.
We're good?
Yeah.
I don't have to see you back for another year. Sounds fair?
Yep, that's perfect.
Perfect. Oh. So as a recap, actually I have a better one. We're going to be right here. I'll be right back on the scene. So basically she had a kid in her foot, that little extra bone right here. She had that. So I took that little piece of bone out of here, reattached the tendon, called it a day. But the graft is a calcaneal graft, put the graft right here to swing the foot over. Now when you're flat-footed, if you see that you're flat, you can see that the foot goes out. So what we do is put the graft on the outside, it swings the foot back in. It's a very powerful procedure. I'm going to go ahead and show you on this bone model now. It's a very powerful procedure, this calcaneus bone. This is the navicular bone where the kidney was. This is the calcaneus bone. Make a little cut right here, open up the wedge, measure how big of a graft I need. So when you're flat, your foot looks like this. It comes out. When we put the graft there, it swings the foot underneath the leg again, or underneath the ankle. So that was a proof positive that once you go like this, your arch collapses. But once you put the graft there, your arch comes back. And you can see in that young lady, her arches came back. She never had an arch. Now she has an arch. She's able to play sports. She's able to get around. She's able to do her activities. She's able to do things that she has not been able to do before. Took away her knee pain and her back pain. She's able to go about and be active. So any problem with pediatric flat foot, kinder foot, pediatric doesn't mean you have to be under 18. We have some adults that had this. You were born with a flat foot, and no one addressed it. A lot of times we don't. I guess different specialties treat it a little bit differently. Sometimes we don't address it as aggressively as we should. But if you have any symptoms, playing sports, that is hindering your foot, you have shin splint, you have continued pain, you really should see us, a board qualified, certified reconstructive podiatric surgeon, foot and ankle surgeon, not just a general physician, not a general orthopedist. you need to see a specialist so we can assess if you qualify for any kind of procedure such as the Evans, or sometimes we put a little implant in here. That's still a little controversial. We put an implant in, it works for some patients. Or sometimes you just need a tendon repair, or you need a combination. The beauty of doing this early is that if we do it late, sometimes we have to fuse the joint, take away the joint, put screws and plates across it. So that's the end stage. We try not to get to that far, especially when you're a child all the way up into maybe 20s or 30s. We try not to do that. When you're older and it collapses and you have arthritic joint pain, then we have to fuse it, something called triple or double arthrodesis. Those are something we do not like to do unless we absolutely have to. You treat it early. We have orthotics to treat it, but it's not going to reverse shape of your foot. If surgery is needed, seek out someone that's board qualified or certified to do the surgery. As you can see, the results are marvelous if done correctly. So, Family Foot and Leg Center, we keep you walking. Give us a call, Naples, Florida.